Hello, a very good evening. It's 8:03 on LBC. I'm Iain Dale, here with you until 10 tonight. Now, in this hour, we're going to take calls on health, because Jeremy Hunt joins us, the former Health Secretary. He's now chair of the Health and Social Care Select Committee, and he's written a book called Zero. It's called Zero, Eliminating Unnecessary Deaths in a Post-Pandemic NHS. And let me remind you, we are streaming this hour live on Global Player if you'd like to watch us as well. Jeremy, welcome. It's a long time since we've done one of these hours. I think it was the leadership contest in 2019.
Gosh, how long ago was that?
Happy days, eh?
Happy days indeed. You heroically flogged around the country.
Yeah, well, so did you. Right, now, let's start talking about the book, and we'll come to calls maybe sort of in about 20 minutes. So if you want to put your call through, phone in right now. The lines are open, 0345 6060973. Why did you want to write this book?
It's actually been 7 years in the writing. I felt when I was Health Secretary, after a lot of conversations, that the system, although the NHS is brilliant in many ways, and my 3 children were born on the NHS and it does much excellent care, it's not very good at learning from mistakes, and it's not very good at listening to people when things go wrong. And I spoke to a number of patients who told me really heartbreaking stories. I think the first couple I met from Devon came to see me because their son Sam had died from sepsis at the age of 3. And when they tried to raise concerns about his care, they said the shutters came down, no one wanted to meet them. And, they felt, really it made their grief a lot worse. And then then we had the junior doctors strike, I became Foreign Secretary, we had pandemics, and the moment to publish this never really happened. But in the middle of it all, I happened to have breakfast with David Cameron, of all people. We were both out of office at that time, and I was telling him about.
I'd like to have been a fly on the wall at that breakfast.
We had a few things. We had a few things to say, But at that breakfast, I was telling him about this book. He said, "The world is full of books that tell you brilliantly what the problem is, but then don't answer the question, what would you actually do about it?" So I went through the whole book. I went through all these stories, and I said, what's the solution? We know the NHS is the fairest healthcare system in the world. We know that rich and poor can access healthcare more equally in this country than other places. But how do we make it the best, the highest quality? And I think this is a good moment for that debate after the pandemic, to really ask what it would take to turn the NHS into the very safest, highest quality healthcare system in the world.
But people will no doubt say you had the opportunity to make it the best healthcare system in the world. And you are the longest serving health secretary, I think I'm right in saying.
Yes, and I fully take that on the chin. There were things I was very proud of having achieved. By the time I finished as Health Secretary, 3 million more patients were being treated in good or outstanding hospitals. Big increase in the NHS budget, many more doctors being trained. But there were things I failed on. I didn't fix the social care system, which I tried very hard to get a 10-year plan for the social care system and more funding in the way I did for the NHS. And so I try to be as objective as you can be, but obviously I wrote the book, and so it is coming from my viewpoint. But there's no point, I think, writing a book like this unless you're prepared to at least try to be honest about what you got right and what you got wrong.
Does the fact that you've chosen to write a book on health rather than foreign affairs, for example, mean that you enjoyed that brief more than you did the brief of the Foreign Secretary?
I would love to write a book on, Britain's role in the world post-Brexit. I had a fascinating time at the Foreign Office. People often ask me which job I like the most. I say, well, if you're talking about enjoyment, there isn't much that beats all those red carpets and presidents and prime ministers you meet as Foreign Secretary. But if you're talking about what gets you in the heart, when you're Health Secretary, you're sitting around a table saying, how can we reduce the number of babies who die because of maternity safety errors? That's a privilege, and it never really leaves you.
But did you find, as Secretary of State, that there were things that you wanted to do, but because the health service is such a vast institution, it's actually quite difficult to make meaningful, radical changes very quickly?
You bet I did. And, I tell the story of that in this book. Bill Clinton had a saying that politics is like working in a graveyard. There are lots of people underneath you, but they're not necessarily listening. And that's what it feels like when
you
you're
sort of pull a lever and nothing happens.
You're top of the pyramid of 1.4 million people, the fifth largest employer in the world, the largest employer in Europe. And why don't people do things when you pull that lever? Well, when you start to think about it, it's very obvious. Doctors, nurses, midwives in busy hospital wards have got to focus on the patients in front of them. And what the Health Secretary's particular priority of the week is really a relatively minor thing. But I do say in this book we should scrap all the national targets, because I think one of the problems we have is that we have more targets in the NHS than any other healthcare system anywhere. And what it does is it means that doctors are always looking over their shoulders at their line manager. Are they going to hit this number or that objective? And in the end, the risk with too many targets is that patients become numbers, and that's not good for patient care.
And delivery is so much more important than process, isn't it? And yet we tend to concentrate on the process and ignore the fact that in many areas of the health service, the outcomes are not what they need to be. I was reading an article the other day where the only league table that we top in Europe in terms of healthcare outcomes is we have the fewest amputations for people with diabetes, something which obviously I have an interest in. In everything else, we're in the bottom half in virtually every sector, sort of cancer outcomes, etc. And that doesn't seem to be part of the national debate.
It needs to be. And that's what this book is saying. You know, let's celebrate the fact that the NHS has become a global benchmark for a civilized society, in the sense that it doesn't matter who you are, rich or poor, young or old, city or country, you can get access to the healthcare you need. But let's say that vision, the original Nye Bevan vision, is only meaningful if the quality and safety of the care you get is good. And I believe we can make the NHS the safest, highest quality healthcare system in the world. I think it's entirely possible within the structures we have. But we've got to be honest about where the problems are. And I'll just give you one example. I became convinced when I was Health Secretary that it was a major mistake to move away 20 years ago from everyone having their own GP. GPs used to have lists of patients, and I think that makes for better care. It's better for patients. We actually know from a study in Norway that you're 30% less likely to go to hospital if you see the same doctor over a period of time. So I changed the GP contract, and as a result of that, every patient has a named accountable GP. And what was the impact? Absolutely nothing. Nothing changed, because it was a tick box exercise. I found out later. People got letters in the post saying, "Dear Mr. Dale, your named accountable GP is Dr. Smith." And then they carried on as normal. And so that's the challenge with the NHS. It's working out how you can engineer changes that really do improve the care received by patients.
I remember when you first became Health Secretary, I can't remember what, there was a particular scandal, I think, in a particular hospital, and you used that example to make a speech where the main point was we've got to become more caring, we've got to become more compassionate, we've got to actually learn to admit when we've got things wrong, as not necessarily as a politician, well, hopefully also as a politician, but also when a hospital gets something wrong, they need to admit that to the people that have been let down. And because they're so afraid of legal consequences of doing that, they didn't. Now, was there a change in that element of the health service in your tenure?
I think there was. I think you can talk to people in the NHS and they will say we're much more open and transparent than we were. We have changed the law so that hospitals have what's called a duty of candour to the patients they treat, to tell them if something has gone wrong and why it's gone wrong. But we've got a lot further to go. If you just think about the most awful thing that could happen in a hospital. Sorry, this is a bit of a grim topic for LBC listeners, but it's a very, very important one.
Yeah, well, we've been affected by this.
You know, if a baby dies, I think most doctors would say, midwives, nurses would say that if a baby dies, that is not just incredibly traumatic for the family, for the mum and dad, but it's horrific for the doctors, nurses, people responsible for that child's care. And they've got to come into work the next day and look after other people. The one thing those people want to do is to be honest, to learn the lessons, to say, I may have got this wrong, to change systems. But they are terrified, if they're honest, they'll just get fired or they'll get struck off the register. Or the regulators will come down on them like a ton of bricks. And so they end up clamming up. Their lawyers advise them not to accept responsibility. And some of these cases, when children are born disabled with a cerebral palsy or something like that, they can take 10 years to settle. And the one thing that is most important of all, which is that you learn the lesson, don't repeat it, is the thing that doesn't happen.
It's interesting that there's a storyline in Coronation Street looking at some medical malpractice at the moment, where sort of the senior nurse has a quandary because she knows that the consultant is not doing his job properly, and she's reported him, and yet she's the one that thinks she's going to be victimised for it.
Yes, but just to be positive for a moment, there are other industries that have gone on this journey. So the airline industry used to fire pilots who made mistakes, and then they realised that if they did that, pilots would cover up their mistakes and they wouldn't change their systems. And in the 1970s, they stopped that and they introduced a no-blame culture. And the result of that change is, in 2017, despite the number of people flying having increased astronomically across the whole world, there was 0 passenger deaths. Now, it then went up a bit because of the MaxJet cases that happened after that. But that's why I call the book Zero. I think when you have, as we have in the NHS, 150 preventable deaths every week, we shouldn't accept that as something that just has to be. We should say, what are we going to do to change this?
James in Chester says, how will we ever make social care a priority when LBC can't even get the name of the select committee correct? It's the Health and Social Care Committee. I think that's what I said, wasn't it? But anyway.
I thought you did. Yes,
go.
Anyway, I was the first Secretary of State for Health and Social Care. So
well, we might. I'm sure we'll get some questions on that in a moment. Well, we've got a lot of calls coming in, so we're going to go to calls slightly earlier than I was intending to. But just before we do that, let's talk a little bit about the state of politics at the moment, where there's been all sorts of leadership chatter over the past few months. I think it is slightly dissipating now, particularly with the news today that Boris Johnson isn't going to get any more fixed penalty notices. But you haven't served in Boris Johnson's government. Was that a deliberate decision on your part? Did he offer you something? And
he did, very generously.
Defence, wasn't it?
It was defence. And that would have been a wonderful portfolio because my dad was in the Navy, very important, as we know now, with Ukraine. But it wasn't for any personal feelings about Boris that I said no. I would have carried on as Foreign Secretary because I'd only done that a year. But I've been in the Cabinet for 9 years, and all my children were born when I was a Cabinet Minister. And I thought, if Boris doesn't want me to be Foreign Secretary, fair enough. This is time to take a bit of time out. And
it's quite something, though, to turn down Defence Secretary for a Conservative, isn't it?
It is, and I don't rule out going back at some stage in the future, but I think for me and my family, it's a time to write some books. In fact, what we're talking about tonight.
Would you, and there is going to be a reshuffle this year, we hear, if he came to you and said, look, I'd like you in my cabinet, Jeremy, would you consider going back?
It wouldn't be my first choice because I'm very much enjoying my role as chair of the Health and Social Care Select Committee and campaigning on patient safety, and you can do that in a different way from the backbenches. But I don't rule out a return to frontline politics at some stage.
But you have to be in the arena to make change. I mean, to quote Teddy Roosevelt's famous phrase, if you're not in the... you're chair of the Select Committee, but that can't be as enjoyable as being Health Secretary, where you have got the power to make change.
That is absolutely right. You make much more change as a minister. But I also think it's important in politics to give people the space to actually think about what needs to change, to think about what they do. When you're Health Secretary, 90% of your time is firefighting. You're just thrown into this maelstrom of news stories. Every single day on LBC or the Today programme, there'll be some health story. and it'll be, in one way or another, the government's fault. And as Health Secretary, you have to answer for that. And the benefit of stepping back is that you can think about some of these bigger changes and really straighten out your thinking.
Well, we'll talk a little bit more about this later, but for the moment, if you'd like to ask Jeremy a question, the number to call 0345 6060 973. There's so much that we haven't talked about that's in the book. And it's actually, I think writing about health policy is quite difficult because you have to make it accessible. It's not necessarily easy to do that, but I think you have achieved that in this book. It certainly holds the attention.
Well, I tell stories of people I met. And that all started the most extraordinary of ways. I've been Health Secretary for 4 months. I was at Margaret Thatcher's funeral. I was sitting in the row behind Tony Blair, John Major and Gordon Brown. And the Bishop of London, in his eulogy, read out a personal reply that Margaret Thatcher had written to a 7-year-old boy when she was Prime Minister, which was amusing. And I thought, I've been Health Secretary for 4 months. I don't think I've seen a single letter from a member of the public. And I thought, that's not right. And I went back to my department and I said, I want to start every day by doing a personal reply, put the letter on my desk. And this sort of sent the civil service into a bit of a tiz because they didn't really like the idea, and nothing happened, and I chased it, and then a letter came back which said, I'm just writing to thank you for my brilliant NHS care. I said, no, I want to know the problems that are happening. And then I got the first one, and I said, I'm so sorry about what happened. And they said, you can't apologise. I said, yes, you can. Anyway, we got into this routine, and I started reading these letters, the very first thing I did. And sometimes I would invite people in when they were really bad, and I would ask them to meet the chief executive, and I would listen. And that was really where this book started. Right.
We'll come to your calls in a moment. 0345 6060 973. Jeremy Hunt here with me until 9 o'clock. It's 20 past 8.
This is LBC. Iain Dale. Text 84850. This is LBC.
22 minutes past 8. You can watch us on Global Player. Jeremy Hunt is with me and he's about to take your calls. We're talking about some of the issues raised in his book, Zero, Eliminating Unnecessary Deaths in a Post-Pandemic NHS. Carl is a new caller in Waltham-on-Thames. Sorry, Carl. What would you like to ask?
Hello, Jeremy.
Hi, Carl.
Hi. As life expectancy continues to rise in the UK, how do we fund social care in the long term? And is a rise in national insurance contributions truly the best way to do it?
Thanks, Carl. It's a great question. I do think that, unpopular though it is, the new health and social care levy is broadly the right thing to do for the very simple reason that it's honest. And we are all, over the coming years, going to be spending more on our health and care. We want to have a good health and care system in this country. And there's never a good time to do something like this, but I do think it's the right thing to do. That said, I think underlying it is a much bigger question, Carl, and I think it's really important that you raised it. And it's this: how are we going to find more money for the NHS and care system, more money for defence when you look at what Putin's up to, and if you're a Conservative, money to reduce taxes? The only way you can do all of that is to find a way of getting economic growth back into the economy. And I think the most worrying thing for the country at the moment is that the growth rate is predicted to be very, very low indeed. So I know this is a big priority for the government at the moment, but that is the only way that Conservatives can square that circle.
Carl?
Thank you very much.
Oh, I thought you were going to come back with some other ideas. Thank you very much, Carl.
Thanks, Carl.
Amos in Chippenham has texted, during the election debates, you spoke with confidence that the Northern Ireland issue of Brexit could easily be solved by technical solutions, which have not been forthcoming. Only Rory Stewart really acknowledged it would be far more complicated than that. Do you regret not being more honest now, given the mess that we're in?
I do think that technical solutions can work fine. And the technical solution that I think can really work in Northern Ireland is to say there's no paperwork for any products exported from mainland UK to Northern Ireland. But if you send those products on to the Republic of Ireland inside the EU's single market, the law will come down on you like a ton of bricks. And that can work, and the issue is not...
So they're not working. There is no technology, as far as I can see, being used here. You have lorries with 700 pages of documents.
At the moment, we are not allowing the law to do its work, and the EU won't allow that. They won't allow us to try that solution. And look, I understand their frustration that having signed an agreement, Boris Johnson now wants to change it this soon. But the reality is that no British Prime Minister, whoever it was in number 10, can tolerate a situation where you can't have a free flow of goods from mainland Great Britain to Northern Ireland. And, from the EU's point of view, this is an area where I'm afraid they do have to be flexible.
But to gratuitously antagonise them, as the government has done this week with the announcement on Tuesday by Liz Truss, saying, well, we're going to legislate to not necessarily abolish the protocol, but certainly amend it without the EU's agreement. I mean, that is no way to conduct foreign policy, is it?
Well, I am someone who's criticised this government on a number of things. I disagree with the cut to the aid budget. I disagree with some of the decisions that were taken in the pandemic. But I think the government has been trying to negotiate patiently over the last couple of years to try and resolve these issues. And in the end, the EU has not moved for this extraordinary reason that they say we can't do that because we don't have a mandate to discuss changing the protocol in that way. Well, if you don't have a mandate to change the protocol where there are problems, that's basically saying you're not prepared to change it. And that is being incredibly inflexible. And I'm afraid that's how I found them when I was Foreign Secretary and we were negotiating the terms of Brexit. It was too often all smiles when you met your fellow foreign ministers, but then when it came to the crunchy discussions with Michel Barnier in Brussels, the answer was a big fat no. And that is not the way that you get a constructive, positive relationship between two European neighbours that share so many values.
How do you rate the performance of the Foreign Secretary, Liz Truss?
Well, I think she has to be robust. I'm not going to sit on this programme and backseat drive one of my successors.
Oh, go on.
I know you'd like me to, and I know you would. You're such a pro. But I'm not going to, because I think it's a very difficult job. She has this particular responsibility to resolve the situation in Northern Ireland. We have a political crisis in Northern Ireland at the moment, and I think we are saying in a very reasonable way to the EU, look, we think there are solutions that would be perfectly viable. Can we have a discussion? And they need to agree to have that discussion.
Okay. Right, Cameron is in Cardiff. Hello, Cameron.
Hiya.
Hi, Cameron.
Hi, Jeremy.
What's your question, Cameron?
Where do you find the nerve to say or to dictate to the NHS that, there's a rogue culture and we need better better quality, better care, when under your watch, most metrics fell. Funding decreased way below what the Office of Budget Responsibility said it should be. Significantly more vacancies. You pledged in 2015 to hire 5,000 more GPs. It went down. It's still below where you wanted it to be. How do you find the nerve to tell them how to run themselves when the Tories haven't funded them properly? They haven't kept up with GDP. It's a shambles. And now you're saying, oh, well, maybe if they would just run a bit tighter, we could save some money and save some lives. It's just, it beggars belief.
I don't think Cameron's a fan.
I don't think so either. But this is a democracy, and I'm very pleased you've asked those questions. And I think if you read my book, Cameron, you'll say that's not what I'm saying at all. I have tried to be open about the things I was successful in and the things I wasn't. I didn't succeed in getting the extra GPs I wanted to.
Why not?
We massively increased to record levels the number of medical students leaving college and going into general practice. It got up to, I think, 3,250 a year. But at the same time as that happened, lots of older GPs went part-time or retired early. So the net increase in full-time equivalent GPs was much lower.
But aren't there people in the Department of Health who forecast these things?
They didn't forecast that we were going to have this increase in part-timers. No one can get everything right, but you don't make a promise like you're going to have 5,000 more GPs unless you think you can deliver it. But the substance of what Cameron says. I believed when I was Health Secretary that the NHS did need more money. Now, we have a system of collective responsibility, which means that when a Health Secretary comes to that conclusion, they can't come into the Iain Dale show and tell everyone that. They have to conduct those negotiations privately with the Chancellor and the Prime Minister. And so when I arrived, the spending was going up by 0.1% a year, which was very tough because demand was going up by 3-4% a year. And I first of all got an £8 billion rise in the annual budget, then a much bigger rise, £20 billion rise. I'm saying that not to say that I got everything right, Cameron, because I didn't, and there were things I got wrong. And I think I said earlier, I didn't fix the social care system, which is one of the reasons why hospitals are still today getting full too quickly, because they can't discharge people enough. But what I've tried to do in this book is look at my mistakes, the things I didn't succeed in doing, look at the things that I was proud of doing, and say, let's look forward. What are the things we need to do now? And the comment about a rogue culture is very much how it feels to some families when something goes wrong and they feel shut out of the system. And I think that's got better than it was, but I still think we need to go further.
What about Cameron's point about the metrics going down under your tenure?
Well, I think you can look at different metrics and come to different conclusions. I mean, as of today, about 2/3 of the hospitals in the NHS are independently rated by the CQC as good or outstanding. I introduced that system so we know whether a hospital is delivering good care or not. And in most cases, the quality of care has got a lot better. What hasn't got better are the proportions being seen in A&Es within 4 hours, and the proportion of people being treated within 18 weeks. But partly
it went down under your watch.
It did.
The target's 95%. It was, I think, 94 point something when you entered, and it went down to 84% when you left.
And that was one of the reasons why I argued for the extra money from Theresa May. Yeah, no, I accept that. That was one of the reasons that persuaded me we needed more capacity in the system, and I argued for the huge £20 billion increase in the NHS budget, which happened 6 months before I left. But I think the pandemic has shown us the importance, if we didn't know it before, of having enough capacity in the system. Because what happened in the pandemic was the NHS was brilliant at treating everyone with COVID who needed a bed, an intensive care bed, a ventilator. But the only way we did that was by switching off other care. And I think when we have the next pandemic, we're going to want to find a way of treating people without having to make that trade-off.
I want to come back to when we come back after the news. Cameron, I don't know if any of your concerns were particularly alleviated there.
I doubt it.
No.
I don't think you're going to ever be satisfied, Cameron, but it's good to hear from you.
Well, Cameron, you had a good go. Thank you very much indeed. We'll come to more of your calls in a moment. You're listening to LBC. I'm Iain Dale. It's 8:32 and Lottie Morley has the news headlines.
There'll be no further fines for Boris Johnson over parties at Downing Street during lockdown. Police have closed their investigation after handing out 126 penalties in total. Joe Biden has supported Sweden and Finland's applications to NATO. The US president rejected opposition from Turkey, who has accused the two countries of harbouring terrorist organisations. And a man described as having a morbid fascination with serial killers has been jailed for life for murdering an 18-year-old woman. Cody Ackland abducted Bobby Ann McLeod from a bus stop in Plymouth last November. LBC weather, largely dry and clear tonight, further scattered showers in northwestern areas and a low of 6 degrees.
This is LBC. Leading Britain's conversation. Iain Dale. Tweet at LBC.
Right, let's go to another call. We've got Jeremy Hunt with us in the studio for the next half an hour. Jude is a new caller in Durham. Hello, Jude.
My question to Jeremy...
Hi, Jude.
...is that... hi. I've got a much valued colleague who's a 35-year-old woman who last year, coming up to 12 months, approached the NHS for help because of a very serious larger growth that she felt that was causing her some serious issues. Now, this young woman, who is an extremely valuable member of society and, contributes greatly in her job, never mind everything else, has been passed from pillar to post. We've had one consultant telling her first that, yes, we'll get some tests, it's not urgent, it's okay, to the point where after that consultant said, well, we'll put you on some sort of pathway and we'll find out what it is. She was then in so much pain a couple of months later that she had to go to A&E, didn't want to because obviously doesn't want to bother the NHS, etc. She was then rushed onto an urgent pathway. You're going to have tests in the next couple of weeks and we need to get you sorted. They did that. They then saw another consultant, so this is the third consultant, in the same NHS area, who then said, oh, no, it's all right now, we'll wait for 12 months for your operation. She then goes back to another consultant because, these appointments keep coming. Oh, no, we're going to put you on a 3-month pathway. We need to get you seen. She's being told, yes, it's very serious. Actually, no, it's not. Yes, we know what it is. No, we don't. In the middle of this, she's had different medications. And I think in the middle of this, we've got a very sort of stressed, upset 35-year-old woman. Now, we work in the domestic abuse sector. We're very big fans of the NHS, etc. But one of the things that we have to do is that when we work with social services, we work with the police, etc., we have to work as a team. And although we work as a team, we also have to put the person that we're working with at the centre of everything we do. And we have you will be aware of, we have what's called Team Around the Family meetings. And what seems to be happening in the NHS is this young woman is having to advocate for herself with the support of colleagues like myself and her family, having to find out things and actually tell the NHS again every time she goes, actually, no, this person told me this person told me that. And to the point now where tomorrow this young woman is having a private appointment because she's having to pay for it because she just can't get any consistency out of the NHS. And, potentially, this is really interfering with her life. She's got a large growth she looks pregnant, bless her. And nobody seems to be taking what I would say that we are told to do. When we have our meetings, somebody takes control at the top. I've done that myself. This person herself has done that in the domestic violence sector. Nobody seems to be doing it in the NHS. And it is, I think it's a big problem that is causing these unacceptable deaths.
And that is an experience, I think, that too many people are having. I've got a friend who went through something very similar 2 weeks ago and has had to go private because he just couldn't get the care that he needed from the NHS.
Well, in my book, I talk about a gentleman from Stoke who had severe diarrhoea, and it took 11 months for that diarrhoea to be sorted out. In the end, it was too late and he died. But in that 11 months... And this is why I think, Jude, your story is so important, and I'm very, very sorry to hear about your friend. And by all means, write to me at the House of Commons, and I'll talk to her MP and see if there's any help that I can ask to be given to her. But too often, it's not that any individual doctor, nurse isn't extremely caring and trying to do everything they can for the patient in front of them, but the system makes it really hard. And I would say that the two things that would really sort out things so that we don't have so many people like your friend, first of all, we need more doctors and nurses. They are very, very stretched, and that means they don't have the time to follow up things as much as they want to. But secondly, we've got to go back to a system where you have one doctor or senior nurse who's responsible for every patient, who says, I'm in charge here. I'm going to make sure we get to the bottom of this problem, and I'm not going to stop until I solve it. And we used to have that when everyone was on a GP's list, and we had our own family doctors. That would be the GP when you're in the community. But it's also the case for hospital care. And I think that accountability is really important, and that actually would make doctors' and nurses' lives much more rewarding as well, because they would have a feeling that they were, actually having a long-term relationship with a patient that they were able to help get better.
OK, Jude, thank you. Colin is in Newbury. Hi, Colin. Colin, hi.
My voice is a bit croaky because I've just recovered from cancer. So,
hello, Colin.
How are you doing?
I'm good, thanks.
I'd like to ask two questions, just briefly. I had wonderful treatment from the NHS, the Royal Berks Hospital. Now, that's not my question. When I was in there and had the meals, which were very nice, there was a local company supplying the hospital with food. Now, I ran up businesses before I retired, and why is it so difficult for small local companies to get their products into the National Health Service? I had a tea company. I could have saved them thousands a week, and they didn't. You couldn't get your foot in the door.
OK, good question. I'll come to that. Tell me your second question, Colin, if I may.
Well, it's sort of mixed together. The question is, I've been in front of these people in the National Health Service, and unless you're a multinational company, they're not interested.
Yes, well...
How do companies get their product
So it's a question of becoming an approved NHS supplier, I guess, in the end.
Yes, and, I think the NHS needs to do a lot better in the way it procures, but at the heart of the problem is that the managers running hospitals are very busy, and their focus is not spending a lot of time finding the best company. They will often go with a big player that it feels like a safe person to have a contract with, And that does shut out smaller companies, and I hope that's something that we can make better. I'll tell you, Colin, where I particularly think we need to help hospitals with really good suppliers, and that's on IT systems, because our GPs have some of the best IT that any GPs have anywhere in the world. Our hospitals are still very, very behind. And I know that in somewhere like Newbury, you will have I know you have a lot of brilliant IT companies, and I'm sure they could really help the local NHS sort out its IT.
OK, Colin, thank you. Let's go to Tony, who's in Enniskillen in Northern Ireland. Hello, Tony.
Hi, Tony.
Hi, folks. Jeremy, first of all, can I just say what you said about the NHS early warning system? You're 100% spot on. I am a healthcare professional, and I think you're 100% spot on with it.
Thank you.
Far too much of a blame culture, so I appreciate what you're saying there. My question is, knowing what you know now, would you, if there was a Brexit vote next week, how would you vote? Would you vote to leave or remain?
I remember at the 2017 party conference, I put that question to you, Jeremy, and you rather surprised me by saying that you would vote to leave.
Tony, my view on Brexit is very straightforward. We are a very big and important country, and we can prosper inside the EU or outside the EU. And I've never believed that we wouldn't be able to do very well outside the EU. I'd like to see us, now we've made that decision to leave, use some of our Brexit freedoms more than we appear to be doing at the moment. But the truth is, when you leave an organisation like the EU, you don't have an automatic right to suddenly power away and do brilliantly well. What you have is a bit more freedom than you had before, and you've got to decide to make the most of it. So I think, for example, we should look at the technology industry and the regulations around technology and life sciences and green industries and say, how can we make those regulations so light and exciting and interesting that every tech company all over the world says they have to have an operation in Britain because this is where it's at. I think
that's not happening now, according to you.
I don't think it's happening as much as it could.
Why?
I think probably, in fairness, because we've had a pandemic and the government's been very had its hands full.
Because you have a civil service that is temperamentally against Brexit and therefore isn't geared up to grab the opportunities that Jacob Rees-Mogg, for example, thinks there are there.
I don't believe that. I know there are some sort of... I never found that civil servants were trying to frustrate me, Sir Humphrey-like. I think Yes Minister has given people this idea that that's how the civil service works. What I found is if you give them a clear lead as a Secretary of State, say, this is what I want to do, they do their level best to deliver that.
But just to be clear for Tony, if there was a referendum today on whether we should rejoin or not, you would vote no.
I'm very happy with us being outside the EU. I think we can make a tremendous success of it.
And is that partly because you know that the next Conservative leader would have to be pro-Brexit?
Well, there isn't a contest, and I'm very happy.
At some point.
Yeah, and I'm very happy where I am at the backbenches. But let me say this to answer your question rather than to swerve it. I think the Conservative Party membership has moved on from Brexit. When you hosted those leadership hustings, we were right in the middle of it. We hadn't actually left the EU, and we had a constitutional crisis with a hung parliament. But I think now people want to know, how are we going to make a tremendous success of the situation we're in?
OK, more questions in a moment. Tony, thank you very much for yours. It's 8:47.
This is LBC. Iain Dale on LBC. Text 84850.
What's the time? It is 8:49 on LBC. Jeremy Hunt is here answering your questions. Let's take a text from Barbara in London who says, Cancer Research report today says if we don't act now, there'll be 21 million people living with obesity by 2040. How will our NHS cope? Should the government reconsider the cost of delaying a 9 p.m. junk food advertising watershed?
I think we should. I think the decision to delay this was wrong. We have to recognise that we are on the cusp of becoming the fattest country in Europe. We're on the cusp of having more obese people in this country than people at a healthy weight. That has huge implications in terms of all the long-term conditions. We're likely now to see in the next year or so more people get cancer linked to obesity than linked to smoking. And I think that we need to do everything we can to encourage people to eat healthily. So I think it is a great shame that the government's done this.
Some people say, well, it's nanny state gone mad. We've all got to be responsible for what we put in our stomachs. We don't need a watershed to tell us that eating 5 beef burgers in a day is wrong.
Well, I think we are a free country. People can spend their money how they want and they can buy what they want. But I think it is perfectly sensible to try and encourage people to make healthier choices, particularly because the biggest problem with obesity is usually in poorer families. And, for example, the buy one, get one free, the bog off that you see in supermarkets, there's a lot of evidence that people actually end up buying more food than they actually need as a result of those deals, and therefore eat more unhealthily and spend more. So I think that
really the role of the state to intervene in something like that? Surely education is the way forward.
Well, it's not the role of the state to stop people eating what they want to eat, but I think yes, we can make a difference. Let me put the question to you, Iain. What's your solution? I mean, do you just sit back?
I don't have to have one because I'm a radio presenter.
Indeed. Well, as someone who did think about these things when I was Health Secretary, my conclusion was there is no one silver bullet on something like obesity, but you try and do the things you can. Smoking is a really good example, another huge public health issue. We've seen a big reduction in the number of people who smoke and the number of people who are likely to get lung cancer as a result by doing lots of different things over 20, 30 years. And I think that's been positive.
Right, let's go to Eamon, who's in Nice in France. Hello, Eamon.
Hello, Ian.
Hi, what would you like to say?
I've lived in the UK for most of my life and moved to France about a couple of years ago at the start of the pandemic, partly because of the pandemic, partly because of Brexit, but let's not get into that.
Let's not.
Over the last, I've been a huge fan of the NHS when we lived there. Whenever something serious happened, it was always there for us. In fact, for a while, we had private health insurance covered by my company, but we hardly used it because we were able to get what we needed to get from the NHS without using it. But now that we've moved to France, in the last year or so, myself and my wife had reason to use the French healthcare system. I was able to get consultant appointments literally within a week, hardly any waiting lists, doctor appointments, you do it all online, very, like next day or 2 days out to get an appointment. And one of the things that strikes me is that, we've had a pandemic in France as well. And I wonder if the problems with the NHS are more fundamental than perhaps we think they are. I haven't read your book, Jeremy, and I don't know whether you addressed this, but I wonder if the fact that in France you actually have to pay something at the point of using a service, 25 euros to see a GP, 50 euros to see a consultant, and you get most of that back or all of it depending on your circumstances, or if you're not in the system, if you're visiting, for example, you wouldn't get any of it back. But is the fact that you have to pay something make people appreciate it more and help fund the system? It just seems that the UK, the NHS situation now is so broken, talking to family and friends in the UK, that maybe a more fundamental rethink of the system needs to be in the discussion.
I'm just imagining you as Health Secretary standing up at the dispatch box announcing that you have to pay £30 to go and see your GP.
Well, Eamon, look, thank you for that lovely thought, Ian, and yes, that would be a challenging one. But Eamon's question is an important one. I don't actually agree with charging for doctor appointments. They introduced that in Germany, and then they withdrew it. And the reason that they withdrew it, apart from the public uproar, was because what we're trying to do in modern healthcare systems is move to prevention rather than cure, to try and stop people catching diseases or allowing diseases to develop. And the trouble with charging is that you put off a lot of people from going to the doctor in the first place. But there is some things that we can learn from France and their healthcare system. They spend broadly the same proportion of GDP on their healthcare system as we do, and yet they have about 20% more doctors per head. And why was it so much easier for you to get in front of a doctor, Eamon? I think it's because they've got more doctors, and we have just not been training enough doctors. It takes 10 years to train a GP, and the problem is that no chancellor and health secretary, when they're having discussions in a spending negotiation, is really focused on the number of doctors we're going to have in 10 or 15 years' time. That's too far away. They don't think they'll be doing that job then. And we need to find a way of taking the number of doctors and nurses we train out of the Westminster political cycle and make sure that whichever government is in power, they are at least training enough doctors for the future.
I've always thought it would be a really good thing for an ex-health secretary to be chancellor, because I think it's very easy for a chancellor to resist spending demands from a health secretary if they've never been in that department before. And I think if you had become chancellor, I think your attitude to the demands of your successor as health secretary would have been very different. I mean, Sajid Javid was chancellor and is now health secretary, but in a sense, I'd rather it had been the other way round, if you see what I mean.
Yeah, really good point. I mean, because we don't have enough doctors, Eamon, we end up wasting more than £6 billion a year on locum doctors. And I don't think they do that in France because they've got enough doctors in the first place.
Jenny in Carmarthen says, I just want to say that my husband died 3 years ago from cancer, and from the time he went to our GP with symptoms until the end of his life, he had excellent care from our local surgery and hospital. I could not have wished for more, both for him and me. I would add that I still have an excellent service from my surgery when I need to use it. And she says, congratulations to RBC on the latest listening figures. Thank you, Jenny, for that. I read that out because it's very easy to get the impression that everything is wrong with the NHS when most people actually do get excellent care from it.
Absolutely right. And I would say to Eamon that don't believe just because we talk about problems in our healthcare system in the newspapers a lot, more than they do in France, that it's automatically better in France than it is in the UK. The reason we talk about it is because it's funded through the tax system here. And so the newspapers and the radio stations, they know that that's what they hold politicians to account for, and we're good at doing that. But actually, we get a lot of things right, and I think we're all very proud of the NHS.
Right, let's take a question from Pranad in Shepherd's Bush. Good evening. What would you like to ask?
Hi, Ian. Thanks for taking my call.
Hi, Pranad.
I had a question for Jeremy. I work as a junior doctor in the NHS. I worked when Jeremy was health secretary and the junior doctor contract dispute happened. So it was very much sold as a contract to help deliver a so-called 7-day service. So did the imposition of that contract against our will help achieve that so-called service, or did you just alienate a whole generation of doctors by doing it?
Well, I have a chapter on that in the book, and in order to try and make it balanced, I actually interviewed Dr. Rachel Clark, who was one of my fiercest critics.
Not a fan.
She absolutely was not, and I interviewed her because I wanted to absolutely understand where the junior doctors were coming from. And I thought it was very regrettable that it happened, because the key messages I wanted to get across on patient safety were much harder to get across after a very bitter dispute that lasted a year. I'm just giving you an honest answer now, Pravit. I think I was right to say that we need to improve weekend care, but I think the junior doctors were right to say we don't have enough doctors in the week. And one of the things that happened as a result of that dispute was that I went to Theresa May and asked her, as her first decision as Prime Minister on the NHS, to increase the number of doctors we train by 25%, one of the biggest ever increases. and we ended up setting up 5 new medical schools to deliver that. So I think the pressure on the workforce really did come to the surface in that dispute, and perhaps there was some silver lining at the end of a very horrible dispute.
It was missold, because I've worked under the old contract, I've worked under the new contract. There's been no difference in weekend staffing.
Well, that, of course, is what I was saying.
As a pretense to get a 7-day service. And it was rather insulting to pretend like we were just working Monday to Friday and then just clocking off for the weekend.
Well, I look in the book at the evidence in terms of weekend provision, and it has got a bit better. But the point I make actually is that the real thing we need to do at weekends is to have more consultant cover. And I didn't manage to change the consultant's contract. And if I have a regret, it was that.
Brandon, thank you very much for that. Let's just finish off with this text from Alan in Caterham. He says, Ian, I was never a fan of Jeremy Hunt when he was Health Secretary, but listening to him now, OMG. He is measured, articulate, thoughtful, and comes across as caring. What a total contrast to a current PM. And if he was leader of the party, I would consider voting Conservative after a break of more than 12 years. Up for the challenge?
That is an impossibly nice note to end on, but also not one I can respond to without being disloyal to Boris Johnson, who I want to succeed as Prime Minister.
Right. My producer in my ear says, "Oh, go on." Jeremy Hunt's new book is called Zero. It is the subtitle, Eliminating Unnecessary Deaths in a Post-Pandemic NHS. I suspect you're going to see lots of reviews of this book in the papers. I suspect you're sort of rating a bit of trepidation, Jeremy, for those.
One of them is going to be by Dr. Rachel Clark, by the way.
Oh, well, that is worth going to have a read of. Thank you very much for joining us over the last hour. Really appreciate it.
Pleasure.
Now, we are going to talk about another health subject in the next hour, not with Jeremy, though. I want to hear from you if you have or have had an eating disorder, or maybe you work in the NHS and you're treating eating disorders, because the number of cases in the NHS, inpatient hospital admissions for eating disorders, gone up by 84% in the last 5 years. My question is, why? 0345 6060 973. It's 9:01.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 9 o'clock, an investigation by the Metropolitan Police into parties in Downing Street during lockdown has been closed. 126 fines were handed to 83 people during the course of the inquiry.